can go to the Netherlands and listen an interview between Gerard Nading and Wout Fontaine on the soft requirements.
Hello and welcome to the contribution from the Netherlands. My name is Gerard. I know many of you. I've attended many COPSOC meetings in the past, and I originally didn't plan to attend this meeting. But now that it's online, it's easy to participate, and I'm happy to contribute. I've chosen to interview Wout Fontaine Pennock about the regulations in the Netherlands. And I would like to start with asking Wout to introduce himself.
Yes, thank you, Gerard. Welcome, everybody. My name is Wout Fontaine Pennock, 31 years of age, and I work for Schouten en Nelissen. That's a renowned learning and development company in the Netherlands. And within this company, I work as a quantitative researcher in a team that specializes in organizational research, such as research concerning employee satisfaction, employee engagement, but also risk assessments concerning a psychosocial workload.
Okay, well, you have a bit of an uncommon name. Can you maybe explain how that works? Wout is your first name?
Yes.
And then Fontaine Pennock is your family name?
Yes, that's correct. My father used to tell me when someone asks you about your peculiar name, you should tell them that you are from a noble British background. But sadly, it's not that exciting. So Fontaine and Pennock are just two family names that were combined about 30 years ago. Okay. So I have my grandfather to thank him for that.
Okay, so thoroughly Dutch, and that's why we also have the tulips in the background.
Exactly.
Okay.
Exactly.
But do you often use the COPSOC in your assessments?
Yes, COPSOC is one of our validated sources, and we use it especially in international research or work with our international clients. And we like the international character and the possibilities for international benchmarking.
Okay.
Yeah.
Well, in the Netherlands, we have a well-known concept. It's called a risk assessment and evaluation. Mm-hmm. Can you tell us what that involves?
Yes, the risk assessment and evaluation, especially for larger companies, it's kind of an audit from the government, and larger companies have to be able to show that they take precautions and take good measures concerning not only physical risk of the work, but also psychosocial risk. So there are actually two parts of this risk assessments, and our company is also involved in assessing all the psychosocial risks. So for example, workload, aggression and violence, or unwanted behavior such as bullying or sexual intimidation. These companies can actually be fined if they don't have good action plans and good follow-ups of these assessments. Mm-hmm. Yeah, I think that's a broad summary of what this risk assessment entails.
Okay. And do you know of equivalence abroad, the equivalence of this risk assessment?
Yeah, there are some European examples. For example, the European Survey of Enterprises on New and Emerging Risks, or ESENER for short. I think I mispronounced that acronym, but that's a European variant of the risk assessment.
Okay.
Yeah.
And an important part of the risk assessment is that companies have to monitor the psychosocial aspects of health and safety. Do you think that the COPSOC is suitable for that purpose?
Yes, I do think it's suitable. There are some themes. So, for example, bullying. The COPSOC touches these themes, but the reason we don't normally use the COPSOC for this purpose is we also have validated skills that go more in depth and have way more follow-up questions. So, for example, bullying, from which part of the workforce comes this bullying? Is it from direct colleagues, for your team manager, or people outside the company? And do you think that the company follow-ups well on these complaints or these types of behavior. So there are skills that go more in depth and have more follow-up questions. And also the character of the COPSOC, that you're supposed to use it as a whole, so unaltered. That sometimes presents a challenge for us, because our clients have specific wants and needs for the questionnaire, and the fact that we can change or alter the questionnaire is one of the reasons we resort to other skills often for this assessment.
Okay.
Yes.
So which aspects in particular are not covered by the COPSOC?
Some missing aspects are, for example, the discrimination or diversity and inclusion is one of the themes we hear a lot about the last couple of years. This is one of the growing interest, I think, in these kinds of research. Questions regarding working from home and corona safety measures. And these last two themes, so working from home and the corona safety measures, they are also spotlighted by the government as important points of attention during audits. In the last year and the coming year, they really focus on these themes, and we really want to see what precautions do companies take to safeguard against the risk of working from home.
Okay. Last year, I cooperated with a group of prevention workers, and they also suggested me a few concepts that they thought should also be covered. And I'd like to mention two. One is need for recovery, and the other is mental distancing. Do you think they are useful?
Yes, I think they're very useful. These are also themes we question quite a lot, or we add a lot in our research. I think especially recovery from work and from the workload, and the mental distancing. We see the mental workload, it increased a lot over the last 2 years, especially since working from home. So people, they're behind their screens all day long, all week long. And focusing on the virtual meetings, focusing on small parts of their screen. So that can increase the mental workload also a lot. The focusing, and it causes a lot of strain and also mental strain. And taking a step back from work, recover from work, these are really themes that we incorporate quite a lot in our questionnaires. Yes.
Okay, thank you. Do you have an idea whether the rules that we have in the Netherlands are quite similar to rules in other countries, or that they differ a lot?
Yes, so I can speak for some international clients, for example, from Germany or Denmark or Sweden or other Nordic countries. And in these countries, the rules are quite similar in the sense that especially larger companies, they should be able to show for concrete action plans, not only to prevent physical risks, but also the psychosocial aspects of the work. So I can't go in too much detail. I don't know about the fine details, but I know that in these countries, the broad rules and regulations are quite similar, yes. Okay.
Well, maybe we learn a lot today from contributions from other countries.
Yes.
That's, I think, almost my last question. The guidelines for the use of the COPSOC mention that workers should be involved in the process of assessment and maybe also in making an action plan. How is that commonly organized in your assessments?
Yes, so in the preparation phase of our research, we always work together with the delegation of the company. And often this constitutes of people from HR, for example, or from the Works Council or team managers. And unfortunately, we can't ask every single employee for the input and feedback, but we would like to make it possible to involve as many workers as possible. But on an individual level, involve every single employee, that would render it impossible to come to a final questionnaire. But we form a focus group or a service team, that's the delegation of the company, and so that we can get a good overview of most of the important topics.
Okay. Well, thank you very much. We've used up our 10 minutes. Let's stop the recording and go live and see whether there are any questions.
Thank you very much. Let's see if we have some questions.
Can't see the chat myself, so if there are any questions,
yeah,
please.
Okay, you're right.
Yeah.
There's something about here at the end, Herman, regarding social inclusion and discrimination scales that is in COPSOC 2 and COPSOC 3, having validity concerns. You have a question, a direct question, if Netherlands have any kind of simplified version of a survey for its use in small businesses, and if you have any comments on engagement and effectiveness in such a workplaces.
I think, Gerard, do you want to answer that question, or maybe I can add something?
If you can, please, go ahead. Go ahead, yeah.
I think there are some simplified versions, and there are also some skills, for example, on work engagement or vitality that we use quite a lot. And maybe there are not one-size-fits-all questionnaires, but there are skills that can be combined and are often combined to come to a questionnaire. And I think they have a lot in common with COPSOC, but also have some diversions from the. So, for example, there are some other teams like work engagement or go in depth in with regards to vitality. So hopefully that answered your question.
Okay. Yes, Gerard. We have another one. Regarding education, if there is a master level degree in work organization specialist.
Yes, so we do have masters in work and organizational psychology. I think that comes closest to your question.
And another question about some misunderstanding regarding psychosocial risk assessment and mental health surveys or EAP programs. Is this the same in the Netherlands?
Yeah, so the distinction between actual risk assessment or just mental health questionnaires, I think they're often mistaken. And I think with regards to the rules and regulation in the Netherlands, and it's mentioned before, just now, that the most important thing I think is that these themes get attention and people can address them if they experience it in their work. And I'm not sure actual risk assessments with a definitive diagnosis or something like that should be obligated, but I think the most important thing is that these themes get attention, and people can address them and can have the opportunity to follow up in a concrete action plan.
Another question about using these more qualitative techniques, not for the risk assessment, but for the action after the risk assessment. What do you think about that? Using focus groups with workers exposed in order to collect their opinion and their experiences about work organization and changing work organization. Do you have any experience on this, or do you think it's useful?
Yes, it's very useful. We also, as a company, we offer these focus groups, or we offer to form focus groups in an organization, because I think it really helps with commitment to these themes and commitment to follow up on these themes, and not only from manager point of view or board of directors point of view, but also really to hear the voice of the individual employee. So this focus group should, of course, consist of different levels of the organization. I think it's way more effective than a large report that ends up in someone's drawer.
Okay.
I'd like to know to which extent that you add other kind of measures together with the psychosocial questionnaires Do you have, for example, staff turnover, something like sickness absence statistics, productivity measures? I mean, organizational level data to support how the work environment is actually working?
So a good question. We normally do this together with HR of the so HR department of the client. They have the data concerning employee turnover and sickness absenteeism. And I think you should really combine these two. So, for example, we ask, do you have the intention to leave the company, or self-rated health, for example? But they have the hard data to support these, or maybe they contradict each other. Then we have an interesting topic to follow up on. But I think it's really important to use all the data that you have and combine them, because I think then you get the most the best insights.
Yeah, and probably also more senior management commitment.
Yes.
We are around there where I can see people. Some people are beginning to leave for other meetings, etc. So maybe we should say thank you to Gerard. And I'm not sure I can pronounce your name.
It's Wout.
Wout.
Yes.